Hi everyone, we'll be discussing alcoholism now. Let's first discuss about its definition. Alcoholism can be defined as a continued consumption of alcoholic beverages despite the health problems and negative social consequences. A person continuously taking in alcohol, even then he or she faces health problems and negative social consequences, and that is called alcoholism. Consumption of alcohol continuously, even when they face severe health problems and negative social consequences. It can also be called alcohol dependence syndrome, ADS. Incidence, in the incidence we can see around 140 million people around the world suffer from alcohol dependence, and higher rates of alcoholism is commonly seen in adolescents. And the etiological factors for alcoholism or alcohol dependence include family history of alcohol abuse or alcoholism in the family, then easy availability of alcohol, then cultural factors or cultural behavior in those cultures. Alcohol consumption is usually promoted. Okay. So cultural factors may also contribute to alcohol abuse or alcoholism. Then personality factors may also contribute to one of the etiological factors for alcoholism. Then poor coping strategies, a person unable to cope with stress, and the person takes the help of alcohol, and that becomes a habit and becomes addicted to alcohol. So poor coping strategies of an individual may be an etiological factor. Then unemployment, loss, financial or loss of loved one and all may be a reason for alcoholism. Then injustice done to a person, or peer group pressure or pressure from the friend circle. Then broken homes, the problems in the family, divorces, or then chronic physical illnesses may also be a reason for alcoholism. Occupational factors may be a problem, may be a reason. Then psychiatric disorders may also contribute to alcoholism. Then depression, the person who is suffering from depression may also take the help of alcoholism to get relaxed or relieved of their depression, and later on it becomes a habit and they become addicted to alcohol. So then now we will discuss about the clinical features, the clinical manifestations of a person who is addicted to alcohol. It include frequent drinking habits. So frequently the person may be involved in drinking. Then preoccupied with drinking. Person is preoccupied with always thinking about drinking or drinking activities. Then drinking while driving. Then changes in their behavior. So all this alcohol abuse and alcoholism changes their behavior, changes their mood, thought process. Then the person gets angry and violent so easily, and lack of control over their drinking. They have no control over their drinking habits, and they continuously use alcohol. Okay, and they'll be spending a lot of time in alcohol related activities, and they will be experiencing withdrawal symptoms when they don't take alcohol. The withdrawal symptoms include nausea, then sweating, trembling, anxiety. All these are painful experiences, distressing experiences the person may experience when he or she don't take alcohol. So those symptoms are called withdrawal symptoms, and there will be increased tolerance. A person may be able to tolerate more and more amount of alcohol, and they'll intake of increased amount of alcohol to achieve a previous level of intoxication. They need to take more and more amount of alcohol to achieve a previous level of intoxication that they enjoyed earlier. Okay, so these were the clinical features: frequent drinking, preoccupied with drinking, drinking while driving, changes in their behavior, getting angry or violent, then lack of control over their drinking, continuous use of alcohol, spending a lot of time in alcohol related activities, experiencing withdrawal symptoms when they don't take alcohol, increase in the tolerance to alcohol, an increase in the amount of alcohol to achieve a previous level of intoxication. All these are the symptoms or clinical features of a person who is addicted to alcohol. Then now let's discuss about its management. They need to be, if it is necessary, they need to go for hospitalization. The hospitalized treatment and care is necessary. Then detoxification is one of the important management. Then vitamin and nutritional supplements if needed. The vitamin and nutritional supplements to be administered. Then administer IV fluids to maintain their fluid and electrolyte balance. Then they have to be involved in group therapy, individual psychotherapy, supportive psychotherapy, family therapy, because family cooperation and the help of the family members is important in solving the issues or solving the problems of the alcoholic person in the family. So family need to be counseled. Family need to be encouraged in to take part in the care of the treatment of the patient. So family therapy, then aversion therapy. Aversion therapy, example for aversion therapy is um, administering an emetic drug along with alcohol. So here there is a combination of a painful stimuli, a distressing stimuli, along with a pleasant stimuli. Okay, here another example is one of the drug of choice for the treatment of alcoholism is disulfiram, which is administered to a patient, a person with alcohol abuse. And when the person takes alcohol for the next time, even in smaller quantities, that causes severe um, painful symptoms such as nausea, vomiting, giddiness, trembling, all those painful experiences, unpleasant experiences the person may experience. So as and when they take alcohol, they experience the same unpleasant experiences. So they better avoid taking alcohol. So that therapy is called aversion therapy. Another example is not in the case of alcoholism. So another example is a child who is having the habit of thumb sucking. In that case, a bitter tasting substance is applied to the thumb. Whenever the child sucks his or her thumb, the child experiences feels a bitter taste, and later on the child leaves the habit of thumb sucking. Another example is to leave a child from the breastfeeding. Uh, a bitter tasting substance applied to the nipple and the breast. Whenever the child sucks the breast, feels unpleasant taste and leaves breastfeeding. So all these are examples, and aversion therapy with disulfiram or an emetic drug may be helpful in leaving the habit of alcoholism. Then next is Alcoholic Anonymous, AA. It is a self-help group and a self-help group of ex-addicts who are all the ex-addicts of alcohol, and they will help and they will instruct and support the alcoholics to leave the habit of alcoholism. They help them to come out of this problem of alcoholism. And Alcoholic Anonymous, they don't disclose the identity of the members of the group to anyone. They keep everything confidential, and that's why they are called Alcoholic Anonymous. So this is a group of people, self-help group of ex-addicts who are helping the alcoholics, yeah, addicts, to leave the habit of alcoholism. So this is about the management. So management include hospitalization, detoxification, nutritional supplements, IV fluids, group therapy, psychotherapy, supportive psychotherapy, family psychotherapy, then aversion therapy, and alcoholic anonymous. And that's all about the alcoholism. So in the alcoholism, we have seen the definition of alcoholism. It is a continued consumption of alcohol despite the health problems and negative social consequences. Then incidents we have seen. Then the etiological factors, various etiological factors have been discussed. Then the clinical features have been discussed, those symptoms that can be seen in a person with alcohol addiction. Then we have discussed about the management, how they can be managed. Okay, and that's all. And thank you very much.